Many mistakenly think that all treatments or injections are the same, often comparing services from different providers like they're apples to apples. In reality, it's actually more like apples to oranges. Let me explain. There are first a few important and possibly life-saving questions that you need to have the answers to before choosing a provider. The first thing to discuss when it comes to joint degeneration is, what are your options? It usually comes down to either a joint replacement surgery, and be careful now that we're going to have a graphic video of just a short bit of a knee replacement surgery. They're actually cutting away the bone and preparing for the joint to be put in.
YMCA doing me.
I think that's enough. So it's either a joint replacement surgery or something is going to be injected in the joint, like cortisone, rooster comb injection, platelet-rich plasma, ozone, Zeal, tissue allograft, which is another name for a donated product, like from an umbilical cord. Now, many confuse a tissue allograft with a stem cell, and many are illegally advertising stem cells when in fact they're tissue allografts. The FDA is handling all that now. Many of them are getting letters to cease and desist. Or it can actually have a stem cell, which the only way to get a stem cell legally is from the bone marrow. So there's a number of things that can be injected, but the questions to ask and know are, what is being injected? Is the doctor going to inject cortisone, which we don't recommend cortisone? We'll explain why in a moment. Is it the gel or rooster comb, which absolutely has its place when the knee just has a little bit of degeneration? When there's fairly advanced degeneration, the rooster comb usually doesn't last very long or make much of a difference. And either way, it doesn't actually fix the problem. It just lubricates a very badly damaged knee. Platelet-rich plasma is amazing for certain things. If it's beyond a certain point, PRP won't make much difference. Ozone, because of the extra oxygen, brings oxygen into a joint, helps it to heal, helps call natural stem cells to the area. But again, it's used best in certain situations. Prolotherapy, again, the tissue allograft or a stem cell. We don't use the cortisone because there's new evidence that says steroid injections cause more damage to the joint. Corticosteroid injections would cause more damage than previously thought and cause rapid progression of the osteoarthritis, which eventually leads to a joint collapse. In addition, they say cortisone for hips and knees are more dangerous than was previously thought. And what Boston University found was it causes the joints to speed up the disintegration and force patients to have early hip or knee replacements. So a lot of doctors hand out cortisone like it's candy. It is very damaging to the joints, and for that reason, we no longer use cortisone. Is it truly regenerative medicine, or is it a stem cell? Right? Technically, as we said, the only legal way to deliver stem cells is via bone marrow extraction. And bone marrow extraction is a quite painful procedure. And the pain can last for months and years after they've taken the bone marrow out of the hip. So as you can see, they have quite a big needle that actually gets drilled into the hip bone, and they extract out the bone marrow. It's typically done, you can see this big x-ray machine, you can see the needle back here. It's typically done under fluoroscopic or motion x-ray guidance, and for that reason almost nobody does that. So again, all those who are advertising stem cells, come to our free dinner, whatever, have a stem cell. They're usually, actually nobody is doing bone marrow. They're all doing the umbilical cord, which is legally called a tissue allograft or cellular regeneration or regenerative medicine. It is not truly a stem cell. And the reason most don't do it that way is it is extremely painful to have done. Now, good news, they actually do have some new ways to extract stem cells from the bone marrow without feeling much more than just pressure. It's just been cleared by the FDA in the last year or two, and we're the only office between Cleveland and Philadelphia certified to do that procedure. Another good question is, where did it come from? Right? I mean, so now let's assume you found a provider and they tell you they're going to do a tissue allograft. Actually, they're going to tell you they're going to do a stem cell. Most don't even know the legal term is called a tissue allograft. And it's unfortunate that so many in the quote-unquote stem cell game right now are physicians who are noticing declining reimbursement from an insurance company. So they take a weekend seminar, hire a nice marketing firm and a consultant. They start posting ads on Facebook or on TV. And they're really, a lot of them, about 80% of them, are chiropractic clinics. And they hire a mid-level to come in and do some work. So it's very careful, where does this stuff come from? Because there's a company that's very famous called Livion. They're no longer in existence, to my knowledge. They actually had 2 mishaps last year, but they had sickened people in 5 states. 17 people have been hospitalized after being injected with products from this company, Livion. There's another company that had some issues. So where do they get them from? It's very, very important to know. And how is it stored? I'm like, look, these things, if you're getting a tissue allograft or a tissue donated, they have to be stored at least negative 80 degrees Celsius. That's far, 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 far cooler than your standard household refrigerator. In fact, a proper freezer is going to cost between $7,000 and $9,000 to store those tissues. Most offices do not have a freezer. Most either bring them in on dried ice, or they use like a propane tank, but it's filled with liquid nitrogen, and they put it into a cooler of some kind to try to keep it stored. A professional freezer like we have actually prints out about every 15 minutes exactly what the temperature is, so that we are sure that the product is stored exactly how it's supposed to be stored. These are very important questions to know. The next question might be, is the care delivered by a medical doctor, or is it performed by a mid-level provider like a physician's assistant or a nurse practitioner? Many, again about 80%, are actually delivered by a PA or a nurse practitioner, and the medical doctor is not even on site. I know one consulting group has over 200 clinics across the U.S. The medical doctor is stationed in Arizona, and his name is there only, and it's a nurse practitioner who does the work. So it's a chiropractor or a nurse practitioner. There is no medical doctor on site. So these are very important questions to know. If it's an injection, are the injections performed via a blind injection? And about 85% of all injections of any kind are done blindly. What that means is the provider just merely feels around and then sticks you with a needle. The unfortunate part is the research shows that when giving a blind injection, let's say in a knee, you actually miss the knee joint. There's actually a capsule, like a water balloon, around the knee, and it is where the fluid is stored. You have to hit that just right, or you actually miss the knee joint 21% of the time. In a shoulder joint, you can miss 55% of the time with a blind injection. So there's a lot of things in the knee when you're going to inject. You got ligaments and bone and blood vessels. A lot of things you can hit, and a lot of people do blind injections. When they're done, patients will state it hurt like heck for a number of days afterwards. That means they ground through some tissues trying to get in there. Not the preferred way to do it. The preferred way is under motion x-ray guidance. Only 2 to 5% of physicians do it this way, like a surgeon. It allows a doctor to actually see what they're injecting, making sure you have 100% placement, meaning that just by using a fluoroscope, your success is going to go up an additional 21+%, just because the doctor can see that the injection got where it needed to be. In this case, the physician is going to bring the fluoroscope around the knee. It's a motion x-ray. You'll see the x-ray. We can see the needle right here. And when they inject, you can actually make sure it gets to where it's supposed to get. In this example, there's a dye being injected. You would think it hit the knee, but in fact it actually pulled out in front of the knee. It actually never made it inside the knee joint. With the fluoroscope, you can see that. In this particular case, they're going to readjust the needle, and you'll see the dye fill in the whole cavity. That's what's supposed to happen with an injection. And again, with a blind injection, especially with a knee that is arthritic and the knee joint is very, very narrowed, your chance of hitting that spot drops dramatically the more damage there is to the knee, because the spacing gets more and more narrow. Fluoroscope is the way to do it. So another question to ask is, if it's an injection, is it a one-time injection? Or are there multiple injections with follow-up evaluations and follow-up x-rays? Unfortunately, most folks give a single one-time blinded injection and there is no follow-up. Again, your chances for success diminish without those added services to make sure that the knee can heal properly and everything that needs to be done is being done. In this particular case, we can see with the follow-up x-ray, there was severe damage. This is an 88-year-old man. There was severe damage on the inside of his knee. Lots of room on the outside, very little room on the inside. On his post-evaluation 6 months later, much more even space throughout the joints. That joint has truly been regenerated. Let's talk now about a sterile environment. Now, this sounds silly, but you're going to see a video in a moment that it's very serious. Does the provider wear gloves? Do they touch anything other than you? If they do, if they touch a table, if they touch a needle, a bottle, a medication, anything, they can carry whatever germs are on there and put that into your open injection site, giving you MRSA amongst other things. Do they clean your joint with a tiny alcohol pad, or do they use full-on povidone iodine like you would prior to a surgery to make sure that you diminish the chance for infection? I have to tell you, and again you'll see in a moment, most just use a tiny alcohol pad. So we're going to witness a physician here of many years of service doing a blind, which means no guidance, just feel around and stick it with the needle, and a completely non-sterile injection. So what that looks like is this. First of all, he's going to mark where he thinks it should be with the marker. So he's going to feel with his bare thumb. If you'll notice, he's not wearing any gloves. Just a simple little alcohol pad. Comes back in a moment. I don't know who this gentleman is, but he neither has gloves on either. That cell phone on his waist is not sterile. Half the things he's touching are not sterile. This gentleman, not sure who he is, hands him a syringe off of a table that's not sterile. Pliers are not sterile. There's so many chances here for infection. And we're going to go ahead and finish with this knee. And he's going to do the other knee the same way. Again, he's going to feel, look how close his thumb is to the opening, no gloves. Sticks her with the needle blindly, hopes you make it inside the joint. The gentleman here, whoever he might be, handing him another syringe and a pair of pliers, also not gloved. And so again, anything those pliers have touched can carry MRSA. Same thing with his other vial he's handing him, can certainly be infected. So it's a completely blind injection, as well as a non-sterile injection, and that's how it's commonly done. And usually there's no follow-up after that fact. Again, we'll come to that. There's other things that should be done. But that's a blind sterile injection by a fully trained, board-certified medical physician, and that's how it is often done. This next video, this gentleman is a chiropractor. This is his nurse practitioner. There's no medical doctor on site. And you'll see, even though they're gowned and masked and gloved, she touches everything. Ideally, the nurse or a phlebotomist or somebody once the doctor is gloved and sterile in a gown, a fresh gown, everything is sterile, the patient is sterilized with the povidone iodine, and everything is clean, the doctor doesn't touch anything other than his needle. So when he touches the needle, if he needs to draw in medication or a stem cell, the nurse practitioner holds the bottle and he punctures it and draws it from that. He actually doesn't touch the bottle. So let's just watch this doctor and his nurse practitioner. He lays the stem cells down there, and she's touching bottles, which has been touched by other people. She's touching this. We have this gentleman here, God forbid he doesn't have a cold or something, or cough or sneeze in the room, because all that goes in the bottle. And she's touching everything herself. And again, it looks like everything is sterile, but if you know anything about sterility, or if you ever talk to a surgeon, that it's clearly a non-sterile environment. And as a result, your chance for infections can be very high. Now, the next thing we're going to see is that they had this patient, I'm going to pause this, they had this patient under a heat lamp for about 10 or 15 minutes. She's going to quickly wipe them with an alcohol pad. That's all they're going to do for sterility. And then in a moment, you're going to see the doctor come in with the chiropractor come in with a laser thermometer, and he's going to try to measure where the hottest spot is on the knee, surmising that would be the point of most inflammation and most damage, and that would be the point to inject. We'll have a discussion about that in a moment. So she wipes the knee. That's their whole sterile technique, even though her gloves are dirty. He's going to spray him with cold spray. You can see him jump. Now she's going to do a blind injection. You can see he has the laser thermometer telling her that this is the point that's the hottest, which makes no difference because the guy was just under a heat lamp for 15 minutes. That's useless. I'm going to pause here. He's actually asking her, because she has a hard time getting the injection in, asking her if he's hit the right spot. If not, he will remark it. And what that means is that, well, she's doing a completely blind injection and it's having a hard time going in, so they're grinding through the tissues. So without a fluoroscope, you're just sticking it in. Now the other thing is this gentleman has a very badly damaged inside knee. You typically would inject on the outside, because it's 3, 4, 5 times as much space. And remember, the entire knee is encased in a giant water balloon, so like putting a drop of red dye in, it goes everywhere anyhow. But once you're in, you'll see the stem cells go right over to the point of damage. And it's much easier to hit even with a fluoroscope compared to doing a blind injection to a very narrowed space using nothing more than a laser pointer, which is insane because I just got done taking a heat lamp off of it. She takes quite a time getting the injection in. We're going to spin around to the other side here in just a moment, and he's still using the laser pointer, there we go, to tell her that's where you should have been, which is nonsense again because he's actually still under a heat lamp. You can see the red on his leg. The heat lamp is still on, so trying to determine a hot spot after being under a heat lamp for 15 minutes and then spraying them with cold spray makes no sense whatsoever. But it looks like good theatrics to the patient. And again, she's injecting on the inside, and again, you actually would probably want to inject on the outside because there's 2 to 5 times more space, and the angle that the needle is going in versus what you would do with a fluoroscope would guide that thing directly in. So even though this person has a nurse practitioner has gloves on and a mask, it was still, they touched everything multiple times. Infection can be transferred. It's completely non-sterile. There's other patients in the same room, etc., etc. So these are very big things. So there are just some of the important questions that need to be asked and to have answers to, and to know if you're going to decide on a provider. Are you comparing apples to apples? Or are you comparing apples to oranges? So there is a reason why so many people looking to end their pain make the extra drive to the Regenerative Medicine Institute in Grove City, PA. The care is provided by a medical physician, board certified, not a mid-level nurse practitioner or a physician assistant with no doctor on site. Our doctor has 35 years of clinical injection experience, who offers an array of different treatments, not just a tissue allograft, mistakenly called a stem cell, for everybody, but depending upon what damage there is in the knee. Again, we don't use cortisone, but the gel shot, the rooster comb shot, does have its place for early degeneration. Zeal or trauma meal are like natural forms of cortisone. Again, for mildly damaged knees, can give tremendous relief. Ozone, PRP. We do use tissue allografts in certain instances. Stem cells, depending on the case, can be pulled from the bone marrow. Prolotherapy. There's a whole lot more. So it isn't a one treatment fits everybody. It's truly based on your exam. It's based on what your short and long-term goals are. Our physician also performs all injections under a very sterile fluoroscopic guidance, so they can actually see what's happening, increasing your chance for success and results, which is what everybody's after in the first place. So our doctor also follows the gold standard, multiple motion-guided injections for the same or the less price than most others charge for a single blinded injection. There's typically injections are given maybe 3 or 4, maybe a few weeks to a month apart to actually help that knee to regenerate and to heal. It's actually the gold standard. There are follow-up evaluations, post x-rays to ensure that your problem and pain are gone and stays gone. We also offer initial evaluations, x-rays, second opinions at no charge as a community outreach service. So it all begins with a head-to-toe evaluation where you are examined structurally, mechanically, neurologically. Look, it's all connected, it all matters, and if you're seeking long-term success, it's what makes the difference. We take x-rays when necessary. We follow that by a knee-to-knee, toe-to-toe sharing of what we found and what needs to be done to stop your pain and fix your problem. So what do you do next? Call to schedule your no-charge evaluation or second opinion. The Regenerative Medicine Institute, 1-800-340-9535. Our phones are answered live 24/7. Even if you've been told that you're bone on bone, if you can bend your joint, we can help. And we look forward to helping you get out of pain, ensure your mobility and independence, and get back to enjoying what matters most.